Welcome to this podcast on the topic of understanding pain. My name is Toby Moen. I gave this presentation to the Trail Running SA Social Club in June 2016. Hopefully you can learn something valuable about pain over the next half an hour or so. Whilst I talk about pain in the context of running, almost all of these principles can be applied to pain more generally. Let's make a start. I gave this presentation the name of Nipper. You might notice it is the letters of the word pain jumbled up and changed. This to me shows that changing the way we look at and understand pain is important. My brother started a business about a year ago called Form Physio. He's a physio as well, and I've since joined him. So we work sort of about 100 metres that way, so we're pretty close to here. I'm going to skip through a few of these. This kind of leads nicely into weather and running. I was in New Zealand for a funeral a couple of years ago and needed some space, so I was near Arrowtown, and there's some really beautiful hills around that sort of Wanaka, Arrowtown, Queenstown area of New Zealand. Being of Kiwi heritage, I know those hills pretty well, and so I got up early and sort of as like a 1700 metre peak and about 18 k's, so it was like a nice trot if you like. It was the middle of summer, this is January, and it started snowing. So in New Zealand you never know what you're going to get, and so I was pretty glad that I had I'd laid sort of like 3 160 merinos underneath this and just had like a little pack on, and then just some almonds and some sultanas, and that got me through this run. But it was pretty fresh there, and that was gusting at sort of 70, 80k winds, so you had a chill factor to that, and it can get pretty cold pretty fast. What I'd like you to consider this statement. So the statement is pain only occurs when you are injured or at risk of being injured. So scientifically speaking, there is a correct answer here. I'd like you to consider it, and I'd like you to text me your answer. So being a bit of a geek, I like stats, I like to see things. What I'd like to propose that we do is that you send either true or false, a T or an F, to that telephone number, and I think it's mine, it is, and I won't spam you back, I promise. And I'd like you to text me your answer now, and I'd like you to text me the same answer at the end of the session. And good statistics would say that we need a 75% recall rate to be able to consider those statistics reliable. So if you give me an answer at the beginning, I'd really love it if you can give me an answer at the end. And I won't try and sway you. I'll just pause for a moment. Right. So I changed the wording of pain to nipper. Nipper is something that like kind of has a nice connotation to me. So these were my goals for today's session. So I'd like to challenge your view of pain, perhaps change your perspectives, upgrade your understanding of pain, and through this, expand your sense of possible. So a common understanding of pain, and perhaps a misunderstanding, hopefully you've all put your answers in now, is that pain equals injury. If pain were to mean injury, it would mean a number of things. It would mean that whenever you felt pain, you were at risk of causing damage, or you were causing damage to your body. It's surprising how many people think along these lines, and if you track perhaps your life historically, we get a lot of evidence to support this statement that pain equals injury or pain equals damage. If you get a paper cut, it usually hurts. If you stub your toe, it usually hurts. If you have a back injury and it hurts for a number of weeks, you probably have a clear mechanism of injury that might have caused that pain. But it doesn't take a lot. So what we're saying there is that if this were true, exercising with pain would always be dangerous. So almost immediately we can dispel that statement of pain meaning damage, because all runners at some point of time have probably experienced pain. You wouldn't be a very effective runner if you weren't willing to exercise with pain. What I hope to talk through, I guess, in your world as a runner is when is it safe to run with pain and when is it not? Pain of exertion is one thing, but pain in a knee or an ankle or a back is another. And how do you know if you can run with that pain or should you stop? Does anyone have a comment or an interjection at this point of time? Because that's a pretty poignant statement. I think it's a pretty loaded statement. Who would stop if their knee started hurting when you were running?
Can I say that when I start running, I have pain in my knee after about 2k,
Yeah, okay. So the question, so what Doug was saying there is like if he runs for 2Ks, the first 2Ks hurt, but then it sort of seems to go away. So what's the underpinning basis of that? And are you putting excess strain or load on your body which is indicating potential damage or potential harm? So I'd argue probably not. If the pain goes away, it's pretty good evidence that, you know, the underpinning reason is probably transient or not something that demands your attention. Is that fair to say? Yeah. So the current scientific understanding of pain is that pain is a very poor measure of damage. And I'm talking particularly here of musculoskeletal injury. So if you break that down like muscles and bones and joints, which might be heel pain or ankle pain, knee pain, hip, groin pain, whatever it happens to be. Even in those situations where so many people use pain as a guide of their return to sport or their participation in activity, it may not be an accurate measure of what is biologically happening to the tissues in the area where it hurts. Does that make sense? Me being a bit of a geek, sometimes I can go a bit too far, a bit too soon. So this means that you can feel pain and not be injured, or be at risk of being injured, or you can be injured and not feel pain. So the second one of these, to be injured and not feel pain, to me features a lot. Seeing you take a picture. If you want a copy of these slides, I'm more than happy to send them to you. So my email address is right at the end and I can just email them to you. So this features heaps in media. Someone has a significant injury, but they power on and they manage to do the job that's faced in front of them. So pain is dictated in part by priority. It depends what you're doing at that moment of time. And your brain is very quickly, mostly outside of your awareness, judging all of the things that you're doing or might be doing or what's important to you. And it's going to change or modify your experience of pain based on what you're doing and what it means. So, you know, the classic might be someone fractures a finger in a footy match and they continue to play and they don't report much pain until after the game. Or someone has a car accident, which I see a lot of people have been in car accidents, and they don't report pain for a day or 2 days or 3 days afterwards. And there's a story and there's a picture of it or something. A lady lifted a car off her baby who was trapped underneath the car and reported no pain at the time of event, but had a fairly significant spinal injury afterwards. So the priority of looking after offspring, of caring for someone, was way greater as a priority of the relevant potential information coming from the body, which might have been saying danger. Does that make sense? The opposite doesn't get much attention, and that's where I deal a lot with, which is people who have pain that prevents them from participating in any number of activities, but the injury underpinning it or the pathology underpinning it may not be warranting of that amount of pain that the person's feeling. And I'm going to give you, examples are helpful, but they also constrain our thinking, but I'm going to give you a couple. I'm treating a chap at the moment with pain here, and he's had pain for 4 years. I took a video of him doing this task because this was painful, and then I got him to sit in a chair, and then I got him to watch the video of him moving. His back pain came on or got worse when he watched a video of him moving into a painful movement. Now, is he crazy?
It's a mindset.
Sorry?
It's a mindset.
It's a mindset, but isn't it biological at the same time? Like if you say it's a mindset, does that mean that it's imagined pain?
Don't think about it, just keep going.
Yeah, and a lot of people would agree with that mindset, but if your pain is extremely agonising, that you're disabled by your pain, I think it would be fairly reasonable to say that it's equally disabling, whether the underpinning injury is mild, moderate or significant. And if he were to try and push through his pain and disregard his pain, eventually his pain would get so intense that he would have no option but to stop. So for a person living with chronic pain or persistent pain, life can be really, really challenging. What I hope to explain is the science behind why someone can feel pain in such a unique situation. Obviously, it requires the brain in this model to explain it, right? So the brain is the most relevant organ. I said I'd explain a couple of examples. The next one is there's this fascinating condition called CRPS. It means complex regional pain syndrome, which just means that the person is experiencing like really full-on pain, and it often happens from just rolling an ankle or something pretty trivial. But what happens is maybe a rolled ankle heals in 7 weeks, maybe 5 weeks, maybe 9 weeks, but we know that at the end of 3 months, 95 to 99% of ankle sprains are completely healed. The tissue has become as equally as robust as what it was at the start. CRPS is a condition where the pain system becomes so sensitive or so responsive that the pain doesn't go away even though the injury has. And in this situation, just opening a door and having a breeze move over someone's skin can be sufficient to create a really huge pain experience. So that's a very clear example where the pain system can move right to one end of the spectrum and be disabling in itself. So this is just one perhaps definition of pain, which is that it's an elaborate protective system with the purpose of alerting the organism to potential danger. And I think probably the most relevant word there is potential danger. Our pain system is pre-designed, it's worked in such a way genetically and environmentally that it will almost always come on before you cause yourself damage. And that to me is the exciting thing, because working with someone in pain, almost always they can work into a little bit more pain or a moderate amount of pain and be quite confident that they're not going to cause themselves harm. Now, there are exceptions to that, and I'm not suggesting that you ignore all pain, but being informed about your pain and the reasons for it can open up a whole range of things that you can do that perhaps you thought you couldn't. The very basis of how pain works is that the brain receives information from a whole range of sources. Back in the 1600s and even today in some of the medical community, there was a thought that a nerve must pick up a message in the body, which was a pain nerve, and send that message of pain up to the brain. And when the brain received that little bit of data, it would invariably produce pain as the response or send pain back down to the foot. What we know is that that's now wrong. The body gathers all kinds of bits of data on pressure and stretch and temperature and chemical balances and all sorts of things, and it sends that raw information up to the brain, and it's the brain's job to then interpret that information, but it doesn't just look at the information from the body. It's obviously going to take in your visual information, your auditory information, and every other sense that you have, but it's also going to draw on every experience that you've ever had leading up to that point of time. I was bitten by a redback in Alice Springs a few years ago, and it was on my neck and it hurt. 3 or 4 days later it didn't hurt anymore, and I was up in Darwin and I was working in Darwin for a couple months. 2 months later, as I drove back into Alice Springs to the exact place where I was bitten by the redback, my pain came back on in my neck. That shows how your past experiences will shape how you feel pain in the future. Now, I was able to recognise that in fact I hadn't been bitten by a spider, and understanding pain biology, I was able to quite quickly reason through why that was. I don't think the venom just started recirculating 2 months later as someone thought it might have that I was speaking to, but rather I think that my brain was doing something quite incredible on my behalf outside of my awareness. It was looking at the situation and trying to pick any points of threat, any things that might pose to me an amount of danger to my safety or my body. And obviously the threat was sufficient enough that my brain thought that it was going to be valuable for me to feel pain, to remind me not to go rummaging through the back boxes of my four-wheel drive that had been sitting in the shed with the doors open for a period of time, and a redback had decided to jump in there. So pain is rapid, it's moment to moment, and it's an evaluation of danger versus safety, and it draws on lots of sources. I think it's important to recognise that pain is determined primarily subconsciously before it is consciously. What that means is that whilst you can probably influence your pain by what you do with your conscious mind, and that will have an impact on pain, most pain day to day is processed outside of your awareness in that subconscious zone. Any points or questions so far? Making sense? I've covered this, so sensory information from the body's tissues is only one of many inputs which the brain considers when predicting danger or safety and whether to produce pain. This gets really, really significant when I see a patient who has back pain and they have a CT scan showing a moderate broad-based disc bulge at their L4-5. The person's understanding of that CT scan finding, which might seem like it's a conglomeration of big words, if the threat value of those words is sufficient, what I mean by that is if they think that that means that their back is fragile or in danger of being damaged in the future, quite literally the pain system will become more reactive and more responsive. So as therapists, I feel we have an ethical responsibility to communicate clearly with patients about the pathology that might exist so that they have a reasonable expectation of what they can do and what they can't do. In fact, for someone who's 40 to 50 years old, a moderate broad-based posterior disc bulge at L4-5 is actually normal. In other words, our skin doesn't look the same at 40 or 50 as it did at 12 or 13, and neither does the rest of our body, but it doesn't mean it doesn't function. Skin still functions even if it's wrinkled or stretched, and the spine even functions if it looks a bit worn. Does that make sense? Any argument against that? Because it's a big statement. This is where, for some people, it's easy to understand something if you can touch it, move it, feel it, experience it. Going to the brain, we don't even fully understand. We have a lot to learn about how the brain works and how it functions. We used to think that it was a whole lot of interconnections of wires, and we had this real mechanistic view of these wires touching each other and moving, and we thought it was kind of set in stone. Now we know that those nerves move and adapt and reconnect. But the next thing we discovered is the immune system has way more cells in the brain than the nervous system. And in fact, the immune cells communicate almost just like nerves. And immune cells and nerves communicate to each other. So it's complex. So I'm going to go into some complex concepts. So what this means is that, and we don't fully understand how some brain networks turns into conscious experience. That's kind of one of the big questions of life and one of the big questions of science. But what we know is that the brain produces pain. What that means is it creates reality for you in a way which is hopefully useful so you can interact with the world and hopefully survive. And because survival is paramount, this system is geared to warn you before something dangerous happens, or hopefully just in time that you can make a change in behaviour. So it's this idea that the brain almost projects your reality. And because of that, there's actually no message that goes to the point where it hurts, which is a big shift in lots of people's thinking. If it hurts in my back, well, messages must go up to my brain, but then doesn't the brain send messages back down to make it hurt there? But in fact, it doesn't work like that, or at least we're pretty sure it doesn't work like that. This is a slice of the brain this way, and it's looking just above your ear, which is where a lot of the information is stored about your body. And what we know is that you have a virtual representation of your body in your brain. And that's why someone can have their arm amputated and still feel their arm even once it's been amputated. And that person's not imagining that arm. For them, that's a real experience. You could mislabel it or wrongly tag it as psychosomatic, but that has a whole lot of stigma and associations with it, which don't give credit to that amazing biology. So no pain messages get sent down to where it hurts, but rather your brain constructs its best guess at what might be happening in your body. And that's really relevant because often we feel pain where there's not actually damage. And back pain is a classic of that, right? You might feel pain in your leg, but your leg's not broken. It's your brain's best guess at what's happening. There's a phrase which is, if you see it, you believe it, or I need to see it to believe it. And optical illusions can form a really nice way of opening the conversation of, is your pain always correct? So there are two surfaces here, or two squares, or two sides of a cube, however you want to see it, and hopefully one of the surfaces looks different to the other. I've seen this so many times now, I'm not convinced, but which one's darker? Which is the darker surface?
The one on the floor.
Okay, so you see that this surface is darker than this surface in terms of a shade of grey. Yeah? Who agrees with that? Or let's say the top surface is darker, hands up. And it might be a point of language. Do you mean that the bottom one is in shade? Yeah, okay, so I agree. Yeah, but if you were to take those two surfaces and look at them in even light, which one would be lighter? Hopefully the bottom one. But the bottom one is shown as such as if it's angled like this. And we know that because this band is bright white. And it blends and kind of turns a corner, which tells us that this must be a lighter surface in shade. And the top one, starting black and blending, must be a darker surface in bright light. And we're given this information by a whole lot of things that you might not even be aware of. For example, there's a horizon, there's a sky, and there's a ground, and that helps us orient ourselves in this space and gives us the representation of the light source must be pretty close to directly overhead. And there's even a shadow on the ground to show you that. So your brain is processing all of this and making them look different. I'm going to tell you that they're identical. So if I take the horizon out, perhaps if I go from there to there, it might change. Does it change for you? Maybe, not. If we take out all of the other information...
Okay, now that together.
Yeah.
So in reality, if we were to take a sample of like the average of these pixels and the average of those pixels, except I missed a bit of the shading on the side, they would be the same. But when we put it in the context of everything else that's going on, it suddenly appears different. And even if you look at this and try and change it, for most people it doesn't actually change. And that shows how significant your experiences and your current place in the world and the context of something will change your perception of reality. And pain is no different to that. We can put people in very simple but very funky experiments that show that just by changing the colour of a light, we can make people feel more or less pain. So if we can change someone's pain just by changing the colour of the light, imagine what your understanding of how pain works and whether you've got a damaged back or a damaged body or hip or knee is going to change your pain experience. And that's what I find really interesting as a therapist, is that if I can help someone towards a more accurate understanding of why they have pain, often they see that they can probably do a whole lot more, and their sense of safety increases. They don't feel as though they're going to injure themselves when they're next in the garden or when they're next in a trail run or whatever it happens to be. So some summary points. Pain is not meant to be accurate. It's meant to serve a purpose, and that purpose is to protect. And for that reason, pain is often wrong. And that's okay, because pain is serving the purpose of protecting you. But if it's become so protective that it comes on with a very small amount of activity, or even watching yourself move, or the door opening and a breeze coming over your arm, then it can become dysfunctional. It can lead to very high levels of disability. Chronic pain costs more than diabetes and cancer combined to our healthcare system, in medical expenses and in lost productivity and welfare and a whole range of other things. It is the most burdensome Australian condition. So appraise the actions of your pain system. Appraise meaning consider them. Consider if next time you experience pain, ask yourself, why am I feeling pain? It might be in part because you have an injury, and that might be true, and you might need to react in a particular way. But that pain might be less than what it deserves, it might be more than what it deserves, and how you react to that will actually in part determine how you next feel pain. You might be capable of much more. What you know about your pain will change the way you experience pain. We've kind of talked through that. There was a really, really lovely guy called Louis Gifford who wrote a paper back in 1998, which hasn't been disproven yet, and in science that's a fairly long time to predict the future, so it's pretty good. And he said the organic basis of mind over matter is very much a scientific reality. And I kind of like that quote. You can't be a physiotherapist today without at least understanding psychology. And you can't be a psychologist without understanding physiology. They are inseparable. This is a lovely mountain in New Zealand. It's called Mount Aspiring. And the Noi group, who are based here in Adelaide, it's kind of cut off half down the bottom, came up with an analogy which is called Twin Peaks model. And it says that tissue injury almost always comes on at a higher level of effort or load than when your pain first comes on. And I've kind of said that a few times in different ways. So here's little you with a walking stick and your pack and your Io Merino and you're heading up the mountain. You get to the point that your effort is becoming great enough that you feel pain. It is very, very likely that you have to go quite a substantial amount further before you injure yourself. Now, there are obviously exceptions to that. I get a brick out of the backyard and I accidentally drop it and it hits my foot. This model kind of doesn't work. So this model is talking about progressive exertion, which is very much the world of running unless you slip and sprain your ankle, where again, injury and pain might happen at the same time, or pain might even come well after injury. Still proves the point though, which is that pain and injury don't necessarily match. This pain system is highly adaptive, and obviously I'm concerned when it's restricting someone from doing what they probably could do. Does that line of coming down make sense in terms of like when pain comes on? Some people have pain at rest, and that's very rarely useful pain. How is it useful if you're sitting on the couch to have constant pain? Even if you have knee osteoarthritis, you're not causing yourself damage sitting on the couch. Well, actually, you might be. But you're not causing yourself immediate damage. In fact, we know that walking with pain in knee osteoarthritis for 30 minutes a day reduces pain and disability by 47%. Which is as good as a knee replacement for most people. So that's pretty exciting. Runners are not at more risk of knee osteoarthritis. So dispelling myths is really valuable because suddenly, that knee pain that I feel, that's okay. It's just pain, perhaps. But in some instances, pain might come on sooner to the point of tissue injury. Athletes are really good at this. They train themselves into progressively more and more levels of discomfort to the point that they actually get accustomed to experiencing pain. And the point next time where pain comes on is a bit further and a bit further. And this is one of the principles that we exploit in performance training, is that we're changing the pain system. People are becoming desensitized. And rarely, but occasionally, someone might train themselves so well that they can experience injury without causing pain. And a carpenter in the old days where they still had hammers and nails would be a really good example. A lot of carpenters would say, I didn't really feel myself when I'd hit my thumb anymore. I just thought that I was a poor carpenter that I hit my thumb and not the nail. So pain changes in response to many factors, and whilst tissue injury might be fairly constant and it changes as well, pain is highly variable and it doesn't necessarily give you a good measure of whether you need to stop or not. I coined this word today and I Googled it and it doesn't exist. So if you beat me to put it on the internet, you can get the intellectual potential for it, and I love it, a surmountaineer. So I think it's a person when faced with a difficult situation pursues their goals until they're satisfied. When I work with people with chronic pain, what dictates their outcome more than anything is their willingness to get up, get moving, but also their willingness to challenge the way that they see the world. If you have like a very concrete, robust kind of like, I don't want to change the way I think, chances are you're going to keep getting the same result. But if you're willing to adapt, change and learn, you're much more likely to be able to do more. You just have to be very careful where you get your sources from, because there's really good information out there and there's really poor information out there. So we talk about this concept of safe to move, even with an increase in pain sometimes. So what's the estimated risk of this activity causing me tissue damage? Do I actually need to stop? And I encourage you to ask yourself this question, because if you actually say, well, I think the risk is very low of me causing damage to myself, then pain isn't necessarily telling you to stop. It might be a pain that you can work with. And sometimes the answer's obvious, and other times it's not. And it's when you get close to that, like the point where you might actually cause tissue damage, that it becomes really hard to tell. If you get pain by watching yourself move or watching someone else move, well, it's obvious that you're not causing yourself harm. But when you're running and you're actually pushing yourself to what you perceive as close to your limit, it's harder to tell whether you can go that bit further or not. And so sometimes that's when it's a good idea to speak to a physio or a coach or someone who understands the activity more than you, and they can help you with your scale of, can I do more or am I about right? Once you're sure you're safe to move, then move more and move with confidence. quite literally, the research tells us that the more you move and the more confident you are with your movement, the less pain you'll feel. So your approach and your mentality towards pain, to a large degree, changes how you feel pain. And that's it. So you've got my number if you texted me. So I'd like you to text me again. Maybe your response is the same. Maybe it's different. If you're happy to text me, that would be great. I'll just make sure they're coming through. 37 new messages. Yeah, they certainly are. I'll sit down with them over dinner tonight. So again, read the question again. So pain only occurs when you're injured or at risk of being injured. So spread the word about pain. For me, this is obviously I'm passionate about what I do. It's work, it pays for, my groceries and my travels and those kinds of things. But we know that the more people understand about pain, the less likely they are to develop chronic pain, and the better they're able and equipped to recover from pain. So spread the word. One way to do that is to follow what we do on Facebook and Instagram. You can look up Form Physio and you can find us. We write a lot about this. We communicate a lot about it. Speak to people about it. Speak to perhaps one of the things that you learned tonight. Perhaps you're capable of more. Email me if you like. So it's Toby@Form Physio, or put a post on the trail running Facebook page and I can respond to that. Give me a call if you need. And that's it.